All right, welcome back. Today we are continuing our BCBA exam practice series where we're going through a full BCBA exam question by question, and I'm breaking down each question how I think you should think about it when you take your actual exam. So if you're new to the channel, welcome. If you're returning, welcome back. Be sure and check out our BCBA exam study guide. The link is in the comments and descriptions below. We're almost done with this exam, and then the full exam will be available. If you purchase the study guide now, I will send you this full exam when it's done for no additional cost. So be sure to check that out. As always, any comments or questions, please email me, leave them below. Happy to help. Study hard, work hard. It's going to pay off. Other than that, let's get into our questions. You want to start TAC training with a 4-year-old client. Which of the following is the best way to teach your technicians to implement TAC training procedures? Okay, on the surface, very simple question, right? It's a simple verbal operant question. On the BCBA exam, they are going to test your knowledge on what evokes certain verbal operants and how you reinforce certain verbal operants, okay? Meaning, mands and request are evoked by motivating operations, and you reinforce mands with whatever was requested. TACs are evoked by nonverbal SDs and can be reinforced with generalized conditioned reinforcers. Okay, so they want you to be able to identify what evokes and what reinforces. So in this case, we have TAC training, okay, and we want to start TAC training with our client. So we need to look for examples of a situation where a label is evoked by a nonverbal SD and is reinforced by a generalized conditioned reinforcer. That's a TAC, right? So let's look at A. Asks the client, do you want your iPad? Only deliver the iPad if the client responds yes. Okay, what type of operant is this? This is the interverbal, right? The client responding yes is evoked by the verbal SD. Do you want your iPad? Okay, this is not TAC training. This is more interverbal training. So A is out. B, only conduct TAC training when the client has not had the iPad for an extended amount of time. So what are you doing here? Well, you're manipulating the motivation, the MO, right, through deprivation. If we're going to do deprivation, right, this is more man training, okay? We want to increase the value of an item to increase the likelihood that the client will request it. Again, not a TACT. The TACT is just a label. C, praise the client when they say iPad in the presence of an iPad. Yes, right? The client saying iPad is evoked by the nonverbal SD of seeing the iPad, okay? And then you're delivering generalized conditioned reinforcer of praise. So C is our answer. Always read all your answer choices. Look for the best answer. D, give the client the iPad when they say iPad in the presence of an iPad. Again, this is man training, right? You're reinforcing them with the iPad and the item they requested for, okay? You don't want to get TACs and mans mixed up. So if they're TAC training, you should be reinforcing with more generalized reinforcers and not the actual item that was labeled, okay? All right, 22. Brian is visiting his in-laws at their house on the river. The in-laws take Brian out to the pier to see the river. There is a sign on the river that states, please no fishing off the pier. If Brian abstains from fishing off the pier, this is an example of what type of behavior? All right, pretty straightforward rule versus contingency shaped behavior. Okay, question. Well, what is contingency shaped behavior? Contingency shaped behavior is behavior that is influenced or maintained or changed based on past consequences, right? Contingencies, if then. Rule governed behavior is behavior that is maintained or decreased or increased, but not based on consequences, okay? Based on a verbal or a vocal rule, right? Or verbal or vocal contingency, okay? In this case, Brian sees the sign, please no fishing off the pier, okay, and abstains from fishing. Was there any consequence for Brian not fishing, right? No, right? The sign is simply a rule, okay, governing Brian's behavior. Okay, there's no contingency in place here. There's no consequence here. There's no learning history here. Brian sees the sign, abstains, and he follows the rule. Okay, this is rule governed behavior. Don't overcomplicate rule-governed behavior, okay? It's as simple as that. So we know it's not contingency shaped. B is our answer, right? It's our best answer so far. Always read all your answer choices. Tangible function behavior. There's no trying to obtain anything here, right? Brian's not trying to obtain a tangible, so that's obviously out. And then punishment shaped behavior. No punishment being delivered to Brian, okay? He simply read a rule, abstained based on that rule. His behavior is governed by that rule. Our answer is B. 23, you and 3 research partners conduct a study on the effectiveness of reinforcement on bottle training toddlers. 4 families participated in the controlled study at your clinic. The intervention was successful, and now you're training other parents on the intervention in their homes. If the intervention works in the homes, the study is said to have what? Okay, so based on our answer choices, right? Sometimes you can read the question and get an idea of what the answer is. And if you can do that on 23, that's great because it's more of a abstract question. But if not, we can look at our answer choices and get an idea of what the question is looking for. And based on our answer choices, this is some sort of validity or IOA question, okay? Some sort of experimental question, right? So if our study was done in the clinic, it was successful in the clinic, and now we're trying to take that study outside of the clinic and see if it works. What are we trying to look at? Okay, let's say that intervention does work outside of the clinic. What does it have? Does it have external validity? Yes, that's what external validity is, right? The ability for your intervention to work in other settings outside of the experimental setting, okay? So if we can take our study from the clinic to the homes, right, we are said to have external validity. Internal validity, right, is more you have a functional control over what's happening in your experiment, okay? There's no confounds or things outside of what you're controlling messing with the experiment. Attrition is research participants dropping out of your study, right? And then IOA, of course, is an agreement between 2 or more observers on the data. We're not looking at any of those. We're looking at this external validity. Will our intervention work outside of the experimental setting? So our answer here is A. Okay, very easy question here. Not all questions on the exam are hard, okay? There's gonna be, I would say, 100 questions on the exam that I think if you study correctly, study hard, that you'll be able to get pretty easily, okay? Not all the questions are hard, and then there are some very challenging ones, okay? 24 is an example of a very easy question, a question that you should be able to do very quickly, okay? As a BCBA, this should be a very simple question, okay? So let's look at it. 24, the RBT on your cases report that your client worked for 2 minutes, 4 minutes, 1 minute, and 5 minutes without engaging in maladaptive behaviors. What is the average duration of working? Very straightforward average time question. What is our average duration? So all we need to do is find an average. How do you find an average? Well, you add all your times together. So we have 2 minutes and 4 minutes, we get 6 minutes. 6 minutes plus 1 minute is 7 minutes. 7 minutes plus 5 minutes is 12 minutes, right? And then you divide your total by the number of data points, which is 4. So 12 divided by 4 is what? 3. Our average duration is 3 minutes. The easy questions on the exam, okay? You should be able to do them fairly quickly, okay? It shouldn't take a lot of brain power or cognitive load to get through. 24 is an example of that, okay? Not every question on the exam is gonna be the hardest question you've ever seen, okay? 24, super straightforward, make sure you get the easy ones correct. 25, a 12-year-old client with an intellectual disability and autism suddenly starts wetting the bed. The client is potty trained and has no prior history of bedwetting. What should the behavior analyst do first? All right, this is a scenario I've actually seen before where we have a pretty typical 12-year-old client we've been working with a while, right? No issues ever wetting the bed. They're potty trained. All of a sudden, bedwetting out of nowhere. Okay, nothing seems to have changed. What should you do first? Okay, A, conduct a functional analysis to determine the function of bedwetting. Well, we're kind of getting ahead of ourselves, right? Remember, functional analysis is the highest and the strongest assessment we can do. Okay, we need to take other steps first before we just dive in and start conducting this big functional analysis on bedwetting. Okay, based on our history, they're potty trained as never happened before. Okay, let's just slow down a little bit and think. Okay, B, rule out possible medical reasons for bedwetting. Yes, right. Anytime this occurs, a situation occurs, it's a new situation, okay, a behavioral situation, right? All, self-injury out of nowhere, bedwetting out of nowhere, okay? We need to rule out possible medical reasons first, okay? And in my scenario, that was a reason, right? That it was a medical thing and was caused the bedwetting, okay? So always rule out possible medical reasons before jumping into behavioral reasons, okay? That's number one. B looks like our best answer. Let's read all our answer choices. C, design a reinforcement-based intervention for an alternative behavior. Again, you don't even know the function yet. You don't know why it's occurring, okay? Don't get ahead of yourself. D, implement a punishment procedure immediately to curb the bedwetting. Nope, we have to rule out other reasons first, and then we can start to do our assessments, okay, to figure out why it's occurring. If it's not medical, then we can go behavioral. So B is our answer. 26, understanding the function of a behavior is the first step to properly treating the behavior. Why is it crucial to understand the function of each behavior? Okay, why is it so important for us to know the function, right? Why do we preach to technicians and parents that the function is the most important thing? What is the reason? A, function tells us what measurement system to use when tracking behavior. Not necessarily, right? We're going to choose measurement based on resources, ability, what the behavior looks like, okay? Function doesn't necessarily guide the measurement system. Just because the function's for attention doesn't automatically mean I'm going to use a certain measurement, okay? So A is not crucial. B, function tells us why the behavior is occurring. Yes, right? Function is the reason the behavior occurs. Behavior typically occurs to gain or get rid of something. B tells us why that behavior or function tells us why the behavior is occurring. B looks good. Read all the answer choices. C, function tells us how often we should reinforce or punish a behavior. No, not necessarily. Okay, data is going to tell us that. D, function tells us what the behavior looks like. What's the word for what the behavior looks like? Topography. If you're going to define the topographical characteristics of the behavior, that is what you would do when you would describe what the behavior looks like. Function is why the behavior occurs. During an initial assessment with a parent, the parent starts listing their major concerns. The parent expresses their desire to increase their son's ability to socialize with his peers and communicate his needs. The parent also wants to decrease the son's self-stimulatory behaviors. Most importantly, the parent wants to help their son's frustration. You explain that you can work on all those things, but frustration will need to be defined differently. What dimension of ABA are you adhering to? All right, so we have all these objective measurable behaviors, right? Socializing, communicating, self-stimulatory behaviors. And then the parent says they want their son's frustration to decrease, okay? What is frustration? Can you observe frustration? Can you measure frustration? No, right? It's a construct, it's mentalism, right? It's a private event, okay? You might think you can observe frustration, okay? But we don't really know what's going on in their head, okay? So you tell them we need to define it differently, okay, before we can start to measure it and observe it and change it. What dimension of ABA are you adhering to, okay? Well, applied, right? Applied is we're looking at socially valid behaviors, right? Apply frustration, is clearly socially valid. It hinders their ability to socialize or achieve academically, okay? But that's not what we're talking about here. We're looking at we want a more observable and measurable definition, right? So A is not necessarily what we're addressing here, okay? B, technological. Technological means your interventions can be repeated, okay? Everything you write can be replicated. You're not designing the treatment plan here, okay? You're simply explaining we want a new definition. C, generality, okay? We're not trying to generalize anything here. Generalization is very important, but it's not the dimension you're focused on here. You are focused on D, the behavioral characteristics of what we're trying to change, meaning whatever we're changing needs to be observable. It needs to be measurable. This frustration just needs to be defined differently. What does it look like? When does it occur? And then we can start to work on it, okay? So the dimension of ABA you're adhering to is behavioral. Whatever we're focused on needs to be observable. It needs to be measurable. 28. Greg just started a job in a restaurant. He's assigned to the salad station. The manager shows him how to make each individual salad. When Greg tries, he incorrectly makes the Caesar salad. The manager tells him to make 5 more Caesar salads the correct way. Of the following answer choices, what best describes what occurred in the scenario? Okay, so this line, the manager tells him to make 5 more Caesar salads the correct way, should have been alarm bells. Okay, and you should automatically start thinking of what? Some sort of overcorrection procedure, right? If we're going to do the behavior again, either the right way or the wrong way, okay, this is going to be some sort of overcorrection. Okay, so what kind of overcorrection are we talking about here? Are we talking about restitutional overcorrection? Well, restitutional overcorrection is overcorrection when we restore the environment to a better shape than it was before. Are we restoring in the environment here? No, Greg is just repeating the behavior correctly that he did incorrectly. Okay, so that leaves us with positive practice or negative practice. Are we positive practicing? Or are we negative practicing? Well, if you are asked or told to do the desired behavior correctly over and over again, that is positive practice over correction. Negative practice is doing the incorrect behavior, okay? So if Greg incorrectly made the Caesar salad and the manager told him to make the salad incorrectly 5 times, that would be negative practice, okay? If the manager told him to make the salad 5 times and then clean up the station and make it look nicer than it was before, that would be restitutional, but the manager told him engage in the target behavior the correct way 5 times. Therefore, we are looking at positive practice over correction. Positive practice or overcorrection is obviously a punishment procedure, okay? Negative reinforcement is not what we're looking at, okay? Behavior analysts have an obligation to focus on behaviors that will be meaningful to the client and to society. In order to meet this obligation, behavior analysts should, above all else, focus on behaviors that are what? Okay, be careful here, right? There's a very specific qualifier that changes this question, okay? What is that qualifier? That qualifier is above all else, meaning number 1, okay, what behaviors are we focusing on, okay? Identified by the stakeholder. It's important to identify behaviors that the stakeholder wants changed, okay, and to do your best to work on those. However, above all else, if we want to meet our obligation, that behavior will be meaningful to client and society, okay? The stakeholder will not always have the best recommendations, okay? Just the case, right? Sometimes the stakeholders want to focus on the wrong behaviors, okay? So above all else, we should not just look at stakeholder behavior. What about the client? Again, the client has a say. The client is part of the treatment process, okay? The client, it's important to think about what the client wants. But again, we're above all else, we're looking for meaningful change for the client and the society. The client might not always know what that is. So what about identified as socially valid? Yes, that is the definition of a socially valid behavior. Behavior that's meaningful to the client, to society, is going to have positive impact and outcome, okay, in that client's life, right? So in order to meet this obligation, we should always focus on behaviors that are socially valid. What about D, identified as easily changed? No, sometimes behaviors aren't easy to change, okay? That's part of our job. So if we want to focus on behaviors that will be meaningful to the client and to society, we want to focus on behaviors that are identified as socially valid. 30, a child is taught to say dog in the presence of dogs. Yesterday at the park, the child was pointing at cats and birds and saying dog. This is an example of what? All right, so pretty common, okay? You might immediately think overgeneralization, and you would be right, but we don't have overgeneralization as an answer choice. So what do? Well, we have to choose something else, okay? So if the child is saying dog in the presence of cats, birds, and dogs, what is that child doing? Are they generalizing a response? Well, think about response generalization. Response generalization occurs when multiple responses happen in the presence of a single stimulus. Here, we only have a single response, which is dog, okay? So are we generalizing? Are we stimulus generalizing? Yes, remember, stimulus generalization occurs when a single response happens across multiple stimuli, which is what's happening here. Dog happens for dog, dog happens for bird, dog happens for cat. The client has generalized these stimuli, okay? Now we need to figure out how we're going to teach them to what? To discriminate, okay? So this obviously isn't an example of discrimination. They're not discriminating. We need to teach them that. And then failure to generalize. No, the client's generalized, okay? Just the incorrect way. Okay, that wraps it up for today. I hope you enjoyed. If you do, please like and subscribe. Coming back every Friday with more questions, okay? Like I said, check out that study guide below. If you buy it now, whenever this exam is done, I will send it to you for free, okay? Any questions, comments, leave them below. Email me, happy to help. Keep working hard, keep studying hard, and I will see you soon.